Welcome everybody. I'm Sergio Gianesini, and on behalf of the Venous-Lymphatic Ward International Network Foundation, I'd like to introduce you to the second video lesson of the not-for-profit project, dedicated indeed to venous and lymphatic patients who are contained at home in these days of coronavirus outbreak. This lesson is dedicated to venous thrombosis risk management. And I'd like to remind you, as in the previous lesson, that of course this educational material is just educational and it cannot in any way substitute the suggestion and the proper evaluation of your general practitioner and of your venous and lymphatic specialist, to which I recommend you to rely on. In the last lesson, we said goodbye to each other together with Professor Peprini, reminding you that we should never treat a stranger, so to never kill a friend, which means that as health professionals, we should always know the risk factors of our patients. So knowing them not as strangers, but as even friends, so to avoid killing a friend by underestimating eventually present risk factors. And the same thing should happen with the patient, knowing his or her own risk factors. So let's start knowing a little bit more about the venous circulation. This road is the venous system, indeed, route to drain the blood in this metaphor, Italian leg, from the most distal parts toward the heart. We could say that we have a deep venous highway and a deep venous highway also that is connected with the superficial venous system through multiple perforating roads, because indeed that's how they are called, perforating veins that are connecting the superficial with the deep venous system. Now imagine we are traveling along these roads and we find a rock, a block on the way. Well, that rock, that block could be called venous thrombosis. Indeed, if you look at the red line in the Italian part of the Adriatic coast, it is like if you are traveling on that road and you find a block for which you are forced to go out from the freeway because indeed of this blood clot, that is the venous thrombosis. As you can see from the orange lines in the Italian map, you are forced to go out from the freeway and go inside the Apennines and driving in these smaller roads that are the peripheral venous vessels that become then engorged, enlarged, overloaded by the venous circulation that has, of course, to go back to the heart. This overload creates inflammation, which is translated clinically in pain in your leg, warm, redness, swelling, loss of function. Now, this overload dilates progressively these roads, so these veins, appearing like varicose veins. Now, be careful. This does not mean that whenever you have a dilated vein, you have a thrombosis, but you could have. So it's important to exclude the presence of eventual blocks on your venous circulation. The same thing when you evolve toward even more serious situations like pigmentation of your leg that are indeed with this brownish color telling you that the iron, and that is like the reason of that color, like really looking like iron, the iron that is inside our blood system gets out from the circulation and deposits itself in the tissues. Now, this creates further inflammation, and together with the venous hypertension, this can lead to the ulceration, so to the opening of lesions, of holes in your leg. That, of course, we must prevent. As we must prevent the leading cause of preventable death, pulmonary embolism, which is a bullet that is detaching from the thrombus, so from the blood clot in your lower limb venous circulation, traveling all the way to your lung, potentially leading also to death. So you understand the importance of this lesson, also considering that one person out of 130 over 65 years old can actually have a clot even without knowing that. And this is the reason why the Venous Lymphatic Ward International Network Foundation is so focused on venous thrombosis as a topic. This is a very important score you can assess in yourself as well. This is the Caprini score, designed by Professor Caprini, the gentleman and the huge professional we have talked at the beginning of this lesson. Before starting, I'd like to remind you that only your doctor can determine if you're at risk for venous thrombosis. So always rely on him. But in the website you see reported over here, you can find this score, and before talking with your doctor, you can already fill it in so that you know your risk. You get several different points based on the risk. 1 point, which means really mild risk, you are getting it if your age is ranging between 41 and 60 years, if you are going to have minor surgery, so less than 45 minutes, if you had past previous major surgery lasting more than 45 minutes in the last month, if you have visible varicose veins, if you have a history of inflammatory bowel disease, if you have swollen legs, if you're obese, if you had a heart attack, if you are suffering for congestive heart failure, or for a serious infection, like, for example, pneumonia. And of course, in this COVID outbreak, in this coronavirus outbreak, it is important to consider that the pneumonia can lead to thrombosis. Lung disease, like emphysema or chronic obstructive pulmonary disease, bedridden for less than 72 hours, or if you have like a restricted mobility for less than 72 hours. If you are a female, also the current use of birth control or hormonal replacement therapy, if you are pregnant or had a baby within the last month, and if you have a history of unexplained stillborn infant, or recurrent spontaneous abortion in the number like higher than 3, if you have a history of premature birth with toxemia, or growth restricted infant. You have a little bit higher risk if your age is ranging between 61 and 74 years, if you had current or past malignancies, if you have planned major surgery lasting more than 45 minutes, if you are using a non-removable plaster cast or mold that has kept you from moving your leg within the last month, and if you have a tube in your blood vessels in the neck or chest that delivers blood or medicine directly to the heart within the last months. And also if you are bedridden for more than 72 hours. A little bit higher risk, 3 points, if you are like older than 75 years old, if you have a history of blood clots, if you have a family history also of blood clots, and if you have a personal or family history of positive blood test indicating an increased risk of thrombosis. The last one and the highest risk, if you have elective hip or knee joint replacement surgery in your history, if you have a broken hip, pelvis, or leg, if you experience a serious trauma, a spinal cord injury resulting in paralysis, and if you experience a stroke. Again, only your doctor can determine if you are at risk for venous thrombosis, so don't rely just on this score, but still calculate your risk so that you can communicate it best with your doctor. Now, these are data extrapolated from the risk analysis we usually do for patients undergoing surgery. So don't consider them in depth, but just know that with the different points you accumulate with this score, you are going to receive different prophylactic measures that are ranging from early ambulation, so the importance of the ambulate as much as possible in these days of containment, the use of compression, so the importance of having proper graduated compression prescription for your stockings in these days of containment again, and if needed, eventually anticoagulation, so drugs dedicated to reduce the risk of thrombosis. Just consider that if there is a risk of bleeding for other comorbidities of yours, rather than using anticoagulation, it is possible to use proper compression, so testifying the importance of compression. As I said in the previous lesson, with the VEN Foundation, we have a dedicated project on fake news in phlebology and in nephrology, so in venous and lymphatic disease. And we welcome also yourself to report eventually encountered fake news in the venous and lymphatic field. In this website, you can report, even anonymously, in whatever language, and you can also obtain a comment, a statement, an analysis of what you have seen, or like an answer to your doubts by the VEN Foundation Scientific Committee, of course, for free, as all the project is not for profit and just dedicated to proper information. With this, I say goodbye to you, hoping that you join us for the third lesson that will be dedicated to the correct lifestyle and graduated compression stocking use during this COVID outbreak days, for which I wish you all the best containment. Thank you.